I'm going to invite you to come have a seat. Those of you who are wrapping up conversations, we are going to get ready to get started. I see some of you are just walking in, and that is great. Please, if you just walked in, make sure you get something to eat, some juice, some water, and then come join us, all right? So I have a few assignments to get us started. First of all, I should tell you who I am. I am Marita Gilbert. I am Associate Dean for Diversity and Campus Inclusion at Michigan State University's College of Osteopathic Medicine. I'm also co-chair of the DEIJ subcommittee for the Henry Ford MSU Partnership. So, thank you. So first, I just want to express warm welcome to all of you for being here this morning. This is our second session of the DEIJ speaker series. So, with that said, I'm gonna ask you to indulge me for just a few moments. There are some things I wanna do before we get started. And the first of those things is just some thank yous. And I prefer to do them at the beginning instead of at the end because there are some really amazing, remarkable people that did a lot to coordinate getting us all here this morning. And so I would like to thank Renee Shepard, who's back there. I want to thank Barbara Breedlove, who is working at the table, but I can see her, so when y'all leave, y'all give her a hug. Thank you, Barbara. I want to thank Amanda, who's out there as well. I don't think she can hear me. Hi, thank you. And Michelle Volker from our DO PhD program for helping us get everything set up this morning. I also want to thank Cam Benson and all of the staff you see in this room from the Pistons Performance Center. They've been amazing to try to just get us all here and do all the accommodations. So, if you can join me in celebrating them throughout this day when you see them, just say thank you, shake their hands. As you can see, all of the details in this room, everything came out amazingly well, and so I'm so proud of that. Now, the second thing that is not on the agenda, Renee, please don't kill me, is I would like all of our trainees to please stand really quickly. Don't be shy. So if you're a medical student, if you are a resident, I want all of you to stand. Now stay standing for just a second. All of the rest of us, I want you to take a good look at all of our trainees. Look at them very well so you can recognize them. When we go into our break, I need every one of you to introduce yourselves to them and some of y'all to adopt them, okay? So we talk a lot about establishing pathways, and that depends on relationships. All of us in this room have something to offer to their success. So look one more time at all of our trainees, and if don't nobody come introduce themselves to y'all, email me, and we will do that. But I really want you all to adopt them, and we need to contribute to their success, okay? All right, y'all can have a seat. All right. So, okay, so as our committee thought about or was tasked with creating a speaker series, we wanted to do so from a framework of making DEIJ actionable, right? So not just talking about what that means, but really what it would look like to do it in each of our roles and in this partnership. So I am so excited, most excited to share a tool to help you define what that might look like in your role. And right now I feel like the one moment where I could say I feel like Oprah Winfrey, because I get to give something away. And each of you here has a very, very, very hot off the presses, it's probably still smoking, copy of Room at the Table, A Leader's Guide to Advancing Health Equity and Justice by Michigan Public Health Institute Executive Director, Dr. Renee Kennedy, who's joined us today and agreed to meet with you and sign all of your books at the conclusion of our town hall. So Dr. Kennedy. So this is how I know I'm loved, because Dr. Kennedy literally just got back from South Africa and then said, I'll still be there, and didn't know she was gonna sign books too. So, so thank you, first of all, for sharing your work, and then thank you for being here with us today. So we chose this book very intentionally, not just because Dr. Kennedy is an alum of Michigan State University, but she's also an exemplar of excellence in connecting DEIJ and health science in her work here in the state of Michigan. So one of the big ideas that has been resonating with me, and when you sign my book, you'll see I've already written in it. But one of the big ideas is your discussion of this idea of leadering, right? So this idea of the theory and practice of purposeful, inclusive, transformative change, and that is something that is always in action. It's not stagnant, it's not trapped in our very static words, and we are always working to activate that. So leadering also holds space and makes room to see things not as we are and not as they are in this moment, but what they can be, right? And then really working purposefully to make it so. So none of you is here by accident. Each of you has something to share with us about how this partnership can ensure that the values of diversity, equity, inclusion, and justice are deeply rooted in our clinical, educational, and research endeavors. So in this room, y'all, there's so much power, which is why I really want us to take time when we conclude for you all to get to know each other, right? Some of y'all work in the same organizations and don't know each other. Please meet each other today. Some of us work in other organizations, but really take this time to find out a little bit more. Because in this room, we are a collection of osteopathic medicine, nursing, allopathic medicine. We've invited folks from veterinary medicine, physician's assistants, public health, trainees, executives, educators, clinicians, researchers, communicators, HR professionals, alums of our organizations, members of this community, and folks who actually grew up in this neighborhood. So there are so many people in this room that I truly admire and respect. And as a lot of you walked in, you saw this is really, really just an important moment. And I'm gonna savor it, but we're not gonna bask in it long because we are here to get some work done. So we are going to, Dr. Kennedy, engage in some leadering this morning. So the biggest task that I have is to introduce our speaker and facilitator this morning. Now, if you look in your lovely folders, you'll notice that I'm tasked with talking about Dr. Barbara Ross-Lee, which is not hard and also very difficult to do without emotion. So you have her full bio, and I'm not gonna read that to you verbatim. But know this, in short, Barbara Ross-Lee is an absolute icon. She is an icon. She's a renowned health policy expert, founder of the American Osteopathic Association's Health Policy Fellowship Program, and training and policy studies for health for postgraduate resident physicians, specifically osteopathic trainees. Dr. Ross-Lee received her medical degree from Michigan State University College of Osteopathic Medicine in 1973. She left private practice in 1983 to become chairperson of the Department of Family Medicine at Michigan State University College of Osteopathic Medicine. A year later, she joined the U.S. Department of Health and Human Services as a consultant on education in health professions. In '91, Dr. Ross-Lee was the first osteopathic physician to participate in the Robert Wood Johnson Health Policy Fellowship. And then in '93, she was elected the first African-American woman as dean of a medical school, of any U.S. medical school, but she went to Ohio University's Heritage College of Osteopathic Medicine, where she served till 2001. So that's what's on the paper, y'all. So this is what I'm gonna say. Dr. Ross-Lee is the first Black woman graduate of my college, the college where I serve as associate dean. And I'm really humbled and honored to thank you publicly, although I do it all the time, but you're actually in the room to hear me say how honored I am to be a part of your legacy. So with that, I wanna say thank you for making a way for me and for so many of us that are in this room and viewing online. I just want to take this moment to celebrate you. all right, we want you to get ready. Dr. Rossi is going to take a breath. Come up here. She's going to lead us in a town hall format discussion. So we're going to hear from her for a few minutes, if you don't mind, some introductory statements. And then she wants to talk to and hear from us. So if y'all thought you were going to come in here and hide, surprise, because she has some questions for us to help us think about how do we do this work in the partnership. So are you all ready? All right, colleagues and friends, Dr. Barbara Rossley.
And don't think you're not going to ask questions. Because if you don't, I'll ask you questions. This is a two-way learning exercise that we're involved in. If you ask questions, I learn something. And you also challenge some of the perceptions and assumptions that I've made. So good morning, everybody. Good morning. Dr. Gilbert gave me 10 minutes to speak on the issue of diversity, equity, inclusion, and justice before you get a chance to say anything. And that is a really, really, really big topic. So because of that, and you'll be pleased, I wrote down some opening remarks so I don't forget anything and say enough to inspire you to ask some questions. How's that? Okay? So bear with me as I read. I want to thank you for inviting me to share my perspective on diversity, equity, and inclusion, and justice. I am honored to be a part of the MSU-sponsored series for many reasons, by the way. And because this invitation, I get a chance to mention many things in the 50-year academic span that I've spent in osteopathic medicine. And so thank you for giving me that opportunity to do this, okay? So thank you, Dr. Gilbert, and also your team, Barbara Breedlove, where's Barbara? And Renee, thank you so much. You all made this homecoming possible. Before I start, though, and Henry Ford has a special place in my heart, one that people probably don't even know. My youngest daughter, who is now an attorney and is a frequent speaker. I got to do the family thing, okay? And it's a frequent speaker in MSNBC. She was a part of the Obama administration. Was in Henry Ford's neonatal intensive care for 2 months. She was born at the weight of 2 pounds. So this hospital has always held a very, very special place in my heart. Beside the fact that my oldest daughter, who is OB-GYN, was a member of the administration here and one of the practicing physicians for many years, and she just left a year and a half ago. She texted me this morning. She said, I know you're going there. I got you. Okay, so let me say, whenever I speak, I try to establish some objectives for myself. And although we'll be speaking to each other today, the objectives are that I want to be engaging. I don't want to talk at you. I want to talk with you, okay? I would also like to be informative. Maybe I can tell you something that you didn't already know. And finally, I want to share my perspective with you. And I'm going to do that by reading to you or sharing with you some of the lessons that I've learned over the last 50 years of being in medicine and academic medicine. Okay. So I hope that you will take this opportunity to ask the essential questions. And they're fundamental. What is diversity, equity, inclusion, and justice? Why is it important? How do we address the challenges? And where does this happen? Where does the change happen? Where is it made? Finally, when does it happen? And then, because you're here, and who does it? And you are part of the who. We're all a part of the who. So let me now just read to you some of the lessons that I've learned. I have 100 of them, but I'm only going to do a few, okay? First, And this is very, as I read your book, I said, we're kindred spirits here. The first lesson that I learned is that words are important. Overutilized words lose their original intent and take on personal interpretations. Even those words that we are here about today, diversity means one thing to us, but I promise you, it means something to somebody else. And so words become important. You got to know who you're talking to, and you've got to connect so that you really communicate. The second lesson, it's not what you say, it's how you say it. You force somebody to react, the answer is no, right? It's not what you say, it's how you say it. Third, acronyms. We have gotten into this world of using acronyms for everything. And when I sit with my leadership teams in any one of the colleges, acronyms become my development tool. If you use an acronym and anybody in the room doesn't understand what it means, you have to put $1 in my bowl. And I can't tell you, we always have plenty of money, okay? Because acronyms isolate you into smaller and smaller groups where only a few people understand what's being said. So I never say DEIJ, never. Let me give you another acronym that you may know. What's CRM? How many of you know what CRM is? Yes, ma'am. No. But good. Yes? Oh, somebody else is going to say the same thing, right? No. CRM means the civil rights movement. Didn't we just lose the power of that by putting it in an acronym that nobody understood? And so I never say DEIJ. It's always diversity, equity, inclusion, and justice. That's where the power is. The power is in the word. Let's see. I told you I had 100. That's only 3. You ready? Rules. You got to know the rules. You don't have to agree with them. You've got to know the rules. And this is especially true of our students who are here today. Know the rules. In fact, you can't change a rule that you don't know. Know the rules. And in fact, in my career, I've learned how to use the rules that were designed to keep me from being successful to make me successful. Know the rules. Number 5, reframe diversity, equity, and inclusion when you're communicating. Diversity is not about numbers. It's about achieving excellence. You can't have excellence without diverse perspectives, so it's not numbers. And that's, whenever we, certainly in the environments that I'm in, you say diversity, say, well, we have 12%. Well, what does that mean? That's not excellent yet. And if you reframe it, people won't talk about the numbers. The momentum will be toward achieving excellence. And you can say, I'm excellent. I'm diverse. Got it? Reframe these words to achieve action words. Okay? And let's see. No one succeeds alone. Even when you think you're doing it all by yourself. I promise you there's somebody back there that's covering your back and said, give the girl a chance. Give the guy a chance. No one succeeds alone. 7, success requires hard work and preparation. There are no shortcuts. There are no silver bullets. You gotta work for it if you want to be successful. Number 8, being qualified is a measure of opportunity and value. not worth. Opportunity and value, not worth. And we see this all the time in pathway programs. Who has the worth to be in the it's about opportunity and value. Number 9. Excellence requires many different perspectives. Number 10. Listening is an important leadership skill. So if you want to say you lead, start listening. Listening is something we don't do enough of. Number 12. Entitlement is a myth. And number 11, new strategies. And if we leave here with nothing but this last lesson today, new strategies are required to solve old problems. New strategies. So, and for the students who are here, I just want to share one lesson that I think you will appreciate, if not today, certainly at some point as you develop into clinicians. And that is, if you don't know what you're treating, don't treat it. Sounds small. I can't tell you how many students, well, I wish I could say it was only students, make that mistake. But if you don't know what you're treating, don't treat it. So, having said that, did I cover? Well, let me just put our system in some context, okay? The American healthcare system has superior science compared to any other nation in the world. And we've developed that science through our commitment to research. The U.S. healthcare system is the most procedurally sophisticated. People come here to get things that they can't get done anywhere else. We have the best technology integration of any other country in the world. We have the highest quality education of the health and medical workforce in the world. Makes you proud, doesn't it? We spend more per capita on health care than any other country in the world. So we have all of these superior tools and resources, yet the U.S. health population is ranked near the bottom of all industrialized countries. How can it be? We've got what it takes. How can that be? And we need to address that problem in the front of our minds, not in the back of it. That's not just data we know. That's the situation we live. How is that possible? And we know that the ranking is a result of many of the health disparities that we interact with every single day. And these disparities are in access, cost, quality, behaviors of institutions and individuals in those institutions, and of course, education. So we've got some pillars that we can address. But fundamentally, we have the best tools in the world to create a healthy population, and we don't have one. There lies the problem. And the formula to address that problem, the formula is diversity, equity, inclusion, and justice. That's the formula. But it's got to be applied in a way that's not simplistic, that's substantive, that is committed to excellence, and that promotes change. One of my biases, I hear this discussion of leaders all the time. We don't need any more leaders. We got some. There's some in this room. We don't need any more leaders. We need change agents. And if having a leadership position helps you do that, that's good. And that's, in all honesty, how I see this health system trying to push forward. We need change agents, not just leaders. Every medical student I talk to will tell me, I'm a leader. And I promise you, I have never, ever in my 50 years described myself as being a leader. But I'm proud if I can make a change. Got it? Okay. Let's talk now, right? Yes. Right, okay. Aren't you gonna sit up here with me?
Oh, well, I can. You coming, Henry?
Come. See? That's how I've spent this 50 years scaring people, right?
So Dr. Zeb has a microphone. Please feel free to share a question with us or a comment with us. And those of you joining us online, Dr. Walker is monitoring the chat so that we can hear your questions as well. So y'all should go ahead and ask the question because I promise you that Dr. Rossley will call on y'all.
Good morning, Dr. Rossley. Thank you so much for being here today. I was struck when you said you had a 50-year career. Well, thank goodness for your youthfulness and your agreement to join us today. I can't imagine in 50 years what healthcare will look like. I'd love for you to reflect now in terms of the tensions that we're seeing regarding diversity, equity, inclusion, and justice, and you can be specific to healthcare. How is that both reminiscent and changed since you traversed into your change agent roles, right, so many years ago? I find that it feels like history is repeating itself, and I'm wondering if there are lessons from when you were practicing, functioning, being a change maker at a different time that we can actually carry forward. I know you said new ideas, but sometimes I think we've lost some of the strong foundational qualities that really could help advance us today in terms of diversity, equity, inclusion, and justice.
Difference? Oh, got it. The difference now are in the numbers. There are more. Look at you. I spent the first years of my life always being the only female, and God knows the only black female, in every audience. Don't waste it. You're important, don't waste it. Then, I earned some of these scars on my back, and I want you now to respect them and use the opportunities that you have to do the right thing and to do it better.
Okay. Good morning. My question is, how do you navigate these spaces as a trainee where you don't have necessarily like that level to address or cause, like, I guess, a ruckus, in lack of better terms? Like, how do you, as a student, how do you go into these spaces and say, like, these are the things that I want to do and these are the changes that I want to have, when, I guess, at least from my perspective, I feel like I am just a student, you know what I mean?
Now, what you say is how you say it? Okay, take just out of there. Okay, I'm a student, got it. Everything has a time and a place. As a student, your priority is being the best that you can be and to do the best that you can do and be successful. Your responsibility is take advantage of opportunities that make you stronger, wiser, better educated. That's what your job is. So that once you get to that place where you can start to make changes, you can. Now, having said that, we all own some space. You may not be able to change the entire healthcare system in this country as a student, but you can change that interaction that you're having with your classmates. That's change. You can expose yourself to other perspectives. That's change, because you become, your presence is broader. And you can share your perspective with the people around you. That makes them better. That's change. Because that's the change that we need the numbers to be able to make a difference from the bottom up. Does that make sense? Okay. Oh, I'm sorry. I have to hold it this way. Got it. Next.
Dr. Rosley, thank you so much for being here. You will not believe the speeches I heard your name in, and I figured the hike to come be in the room when you're there is really important. So thank you. You've already made a big difference. I just have a question for you, and I'm going to circle back a little bit to the question that, that was asked initially about the differences. And I wanted, so it seems to me that, and it is true, that there's a lot more numbers of individuals from diverse backgrounds in more spaces. So in some ways, we live in the best of times, but in some ways, it is also the worst of times. And I wanted you to reflect and maybe share some ideas about how you navigated the challenges of being maybe the only Black woman or the voice that was not automatically given credibility and yet remained connected to the importance of your presence in rooms. How did you maintain or just basically build that resiliency emotionally and yet stay connected to mission?
One, it's based on expectations. It's what you expect. And building those expectations is a personal effort. The first thing I learned in medical school, and I can still see the professor and I still know the line, and that is, he told the entire class, and I felt so proud, a medical student getting ready to go out into a clinic. And what he said was, you are what you communicate. And I thought that meant I would be walking out there communicating as a fledgling physician, a student doctor, okay? The environment didn't change because I became a medical student. What I communicated when I walked in a room was Black female. They never got to the medical student part, all right? So I had to learn not to use the people around me to judge what I was capable of doing, because I couldn't depend on them or trust them. Even when they were applauding me, I had to make my own personal judgment as to whether or not if it was true, that I could have been even better. So I had to guide myself through this, through perspective all the time, Did I do this? They would say, oh, you did a great job. And I have to say, I didn't really do a great job. I could have done it better. And I didn't expect them to tell me when I was good. Okay. You be good. And if you're not good, only you know what you don't know, okay? Not that exam that you did or didn't pass, okay? Only you know what you don't know. And it's your job to know it. Let me tell you a little story. I fought my faculty. It's always a lot of fun. I fought my faculty at one of the universities where I was dean because I insisted that all students who took an exam got the exam back so that they could find out what they got wrong and be able to look at it and learn what they missed. If it was important to know, they needed to know it, right? And then they didn't have to do all of these pre-board exam exercises. But your job is to know, not to just pass exams. That's what your job is, to know. And the faculty pitched a fit, and you know why? Because it meant they couldn't use those questions again. They had to, it was more work for them, and I recognized it. But I fought that battle, and I got those exams back to those students. Not one student used that exam to review what they didn't know. They were moving on to the next exam. Don't let the system control who you are and what you can do, okay? Does that help a little bit? Can I move around? Yeah. Good. I don't know where the camera is. It's okay?
They'll catch you.
Gotcha. That's called power. Okay.
My name is Uzma Shah, and I just want to shake your hand first. Thank you. I have a question. So Harvard University had their inauguration of their 30th president, the first female black president. I had the privilege of being invited to that inauguration. And she had some really powerful words to say, right? And one of them was that knowledge is our promise, right? It's Harvard, knowledge is our promise. But she also, mentioned on how when you allow opinions to collide, you can actually generate more knowledge, right? So as we speak about this and we speak about diversity, equity, inclusion, and justice, how do we use that platform of allowing opinions to collide to encourage more knowledge within this framework?
Although I probably would not have used the word collide.
Right.
I depended heavily on
Thank you.
engage. Yes. Okay. Yes. Allowing opinions to engage each other. Everybody learns. And engagement and collaboration are the tools that I used throughout my career, instead of colliding. One of the things, if you force the person that you're trying to influence or move, if you force them to react, it's about what you say, how you say it, then you don't win anything. Once the answer is no, now you've got to back up and come at them from so that you make the work harder for yourself, okay? And when you engage with somebody, so as opposed to collide with them to learn, although collisions are learning opportunities too, by the way. Really, that's what all those lessons were about.
I think what she meant was encouraging debate, right? Encouraging debate where you are doing so in a very respectful domain, but you're encouraging debate, and really passionate debate, which will allow the other person also to be able to share what they have to say, but with the same thing, that your ultimate outcome is knowledge or advancing knowledge. And in this case, and knowledge for anything, right? Knowledge for healthcare, knowledge for physics or whatever. But here we're talking about this really particularly important entity, and how do we use that framework to pursue this or advance this?
Which is essentially what I'm saying, and now we're starting to collide, okay? No, don't move.
That's
don't
why
move.
I shook your hand first.
No. And that,
Thank you.
that gets us back to words are important. Collide is not the positive word that keeps you encouraged or engaged, okay? And that's the only, although if it turns into, and sometimes there's nothing you can do because they're already, which is another rule I have. Don't be predictable, because if you're predictable, the answer's already no. Okay, that's the collision, right? That's the collision. So, so you can't allow them to predict where you'll be, but even when you are and you collide, there's a lesson in there, right? You learn something from it, and I couldn't agree with her more. And I think part of her message is you got to be talking to people. You've got to be sharing ideas or impressions that are different from one another. That's the only way you learn. That's the only way you learn. Okay, got it. Yeah.
Thank you. So if we can drill down on that a little bit, I think what we're also talking about is a multidisciplinarity of perspective, right? And so what I'd like to do is maybe model that with this next question. So if we are to think about how do we do this work, the work of this partnership, right? Using the brilliance of all of us in this room. So how do we get researchers to talk to the folks who are doing the hiring, and the folks who are doing the hiring to talk to the folks who are our faculty, right? And the faculty to then talk to folks who are doing very specific work in cancer. Do you understand what I'm painting here, right? Because part of that is how we do the leadering, how we activate, how we make it actually central, right? Integral, foundational in our work. So how then, and maybe you all can start to think about those things, right? So public health, how do we talk to maternal health? How do we talk to cancer, right? To really think about a very specific work in this partnership. And then how do we also, as Dr. Kennedy invites us to do, hold space and then make space so that we're not talking just to ourselves. We walk down the street, right, and then talk to the folks who actually still live here, and their voices are central in what we're doing as well.
But you know, it is a walk. You have to start with what the issue is, and then you have to know, part of that dialogue is, where do you stand on that issue? Where are we together? What things do we share? And you take it from the share to the next step, you know? And as long as you identify what the issue is and the commonalities that you have with the people involved that you're engaging, then you can take it to the next step, okay? Then that's the action step, okay? What action needs to take place? But identifying the action identifying what we know needs to be done doesn't get it done. Did you know that? That final step, is incentivizing people. I want to do it, but I can't because I have to do this. Or I want to do it. So it's a four-step process. Relating to what you want to get done, or even identifying what the action plan is. So now how do you make it happen? And that's that final step. That's the final step. Right?
I can start here. Dr. Rossley, thank you again. He's getting the microphone. You know, it's very interesting. We had this exact conversation in East Lansing last night with all the clinical and basic science chairs. Exact question. How do we bring health equity and other topics into our research departments and our clinical departments? And in fact, two of the things you've already identified. One is recruiting those individuals that are committed and accomplished.
He can't hear you. You got to speak. I've learned. See? Another lesson learned.
Well, recruiting investigators that are accomplished, and I've already indicated that this is their path. because with that, you will be able to bring in then those junior investigators, clinicians that are interested in that work. So that was the first. And the second, I think there were some immediate ways of doing health equity research in the research that's already being done. And so we already know there are diversity NIH adjustments that we can add on to grants that are already accepted. And as chairs and as leaders, how can we then enforce or encourage those diversity? Yep, right.
And you know, it's funny. That's an incentive is a word very similar to diversity. The minute you say it, everybody has a picture of what you're talking about. Okay. Incentivize does not mean money. Okay, can we start there? Because there's something that everybody, if it's status, actually, if it's a window in their office, whatever the heck it is, okay, incentivize. Okay.
I think this is working, right? So I apologize for my accent. You may not understand me in this simultaneous translation if you don't. So, so I want to apologize up front. My comments are meant with the maximal respectful interpretation. It's not pushing against you. I just think, no.
With that. Come on.
I think I want to start off by two observations. One is that I think something everyone in this room knows, that culture will eat strategy for breakfast, lunch, and dinner. And the second thing, to my very valued friend Uzma, I wouldn't be quoting the president of Harvard University at the moment, but I would take that off. I think I do a lot of speaking around the country around leadership, and one of the problems that leaders have is not recognizing rocks in the road that they have to go around or climb over or go around. And I think this is very nice having this discussion amongst valued friends in Michigan, but there are certain areas of this country that you can't have this discussion, right? So let's recognize that, number one. And that there's systemic barriers that you have to overcome these days in order just to have this, what seems to me, very rational, uplifting discussion. I come from a group that was systemically excluded from healthcare in the beginning of the 20th century, so I am very aligned in this discussion. We had to build healthcare systems ourselves, right, in order to get residencies and education and stuff like that. So
Osteopathic medicine too, by the way.
Yeah. But so I think having this discussion is needed, but I think we need to have that if we want to affect systemic change, there's huge obstacles to this. Not only in people's behaviors, but in political structures and emerging discussions that would put an end to any initiative that promotes the diversity of our workforce. So I don't mean to throw oil onto the fire, but I think it's a very important perspective that we have to adopt.
Based upon, now that we're engaged, right? We got it? Okay. Let me push back on you just a little bit, okay? In fact, if you don't push, progress doesn't get made. We just all feel comfortable with where we are, okay? So I'm pushing back on you now.
We're having a parlor discussion, right, amongst friends, right? Okay? There's a very famous scene. There was a movie in the 80s, Manhattan, Woody Allen, and there's a very famous opening scene where Woody Allen's walking down the street with a friend of his who says, the Nazis are marching in Skokie. And his friend says, yeah, there was a great satirical piece in the New York Times about the Nazis marching in Skokie. And Woody Allen says, you don't write satire about Nazis, you go with baseball bats, right? So we have to realize this is not simply a very civilized discussion amongst friends. I know you mentioned the CRM at the beginning, but the struggles is no less than that epoch in history, right? So,
but let me, as an engagement process, let me just start where I would start with you. You opened your comments with doesn't include culture.
Oh, no. I think culture would defeat this.
Culture will defeat this.
Would defeat this if we don't recognize that.
Okay,
right?
so
We have a great.
tell me what you mean by culture.
In the state of Florida, this kind of discussion is banned.
Tell me what you mean by
Shared values.
shared values. Then let's use shared values, okay? Because
Yeah.
then I can find a common ground.
We can
Find
find
some sharing.
many
But
things
not-
we can find common ground on.
But not, yeah, absolutely.
Yeah.
But that's where you start. Don't get me wrong.
Yeah.
It will take longer in Florida than in, I don't know where else, in Detroit. Okay.
We're
But no,
very
what I'm
civilized
saying
here in
is-
Michigan.
What I'm saying is language is a part of the barrier because language communicates different things to different people. So in order to engage, to make progress, okay, these issues weren't created overnight. They're not going to be solved overnight. But fundamentally, we have to approach them, have a new way of engaging people. So that's where we start, okay? So, yes, it's the language.
So I'm going to push back on you in the
Words are
language.
important. Good.
So-
I love pushback.
In the beginning, in my faith tradition, we follow the 5 books of Moses, and there's this narrative that we are reading this week about how man tried to build a tower to go to heaven, right? And how did the Creator stop that project? He created languages, but the languages were all different, so people couldn't understand each other. And I feel that some people in this, we're speaking common language, right? I think there is a cultural unity in this room towards a common goal. But there are people speaking other languages that clash. You didn't want to use the word clashing, right? So that clashes with us, right? Collision. I think we're being a little semantic.
But the solution is to recognize that. If you don't recognize that, you can't come up with a strategy to be able to engage it, address it, whatever. But so you have identified an issue that we have to recognize if we want to work together, and we have to work together to solve these issues.
But what I'm saying is we will work together. There's forces out there that refuse to recognize our language and refuse to work with us. And so I'm uplifted by your optimism. Thank you.
Hello. First of all, thank you so much for coming and speaking to us, Dr. Rossley. You know, I spoke to my daughter, who is a second-year medical student in Alabama, and she was so excited to know that you were coming. She's actually in the Ross Lee house in her medical college in Alabama.
And I didn't even know they had a Ross Lee house.
Just to know how famous you are, in case you don't need another reminder. You know, I would love to hear your perspective, for me as a clinician, how to take care of folks who are in these they, for whatever reason, have barriers to access to health care. So we're in Detroit. Henry Ford is committed to the city of Detroit. It's part of our DNA. You know, we would consider ourselves amongst the best healthcare systems in the country. You have been in DC, you're in Baltimore, where similar types of issues are present. Over your career, can you sort of tell us how some of these barriers between patients and these institutions have gotten lower, and what can we do to further break those down going forward in order to take care of the folks that are part of our core constituency and mission?
Really great question. Part of it is the structure that we are asking people to engage with as patients, let's say, okay? We've got to get to a high ground on this issue. How do we get to those communities that fundamentally need to be engaged in healthcare, right? And the more sophisticated medicine becomes, the more distant medicine becomes from the patients. They're not patients yet, from people, from the communities, which is why I like the brand name change for Henry Ford, because it's about health. It's not a system, okay? But the more distant the system becomes from communities, and New York is a classic example. We have these major medical institutions sitting in the middle of a community and not a part of the community at all, okay? So we've got to figure out a way to bridge the system with the communities that need them, both structurally and systemically, okay? And that takes vision, and it takes commitment to know that it needs to be done, okay? You have to commit to making that shift. Because of the continuing separation, because of the media attention, because of the data, because of the research that we publish, that very community is losing its trust of medicine. And if we lose the trust of the community, we have no way to solve some of these health issues, definitely the disparities. So it doesn't mean that as physicians or health providers that you have to go out and deliver health care. But you got to get out in the community so that you know what the community is and the community knows who you are. Does that make sense? And I see this, actually, I had a resident here at Henry Ford. Oh, let me back up. My ophthalmologist is here and had a resident who didn't know who I was, just this elderly black female coming in, and she walks in, and she looks at me, and she says, "Lean over here, sweetie." I jumped. I was so surprised. Now, that may have been my mindset, thinking I was more important than I am. Is this better? Okay. But I jumped, and she said, "Did I say something wrong?" I said, "You absolutely did. You don't know me." She's 25 years old, and I'm 26. What? "Lean over here, sweetie." I have no respect, no trust of a physician who would approach me that way, okay? The saddest part is that the physician was in the room and didn't correct her. We have a job to do. We can't expect somehow or another this happens through a miracle. We have to value and care about every patient. So I add to the classic jargon, we develop physicians who are caring, compassionate, and competent. I add trustworthy, okay, and respectful, okay? Because we have a knowledge, but that doesn't make us superior to the patient. And in fact, for the students, if it wasn't for patients, you would never learn medicine. And they allow you to do that. They allow you to be involved in their care, okay? We forget that somewhere along the way.
So true, thank you.
We have a question in the chat, and the question is, we hear a lot about representation and being at the table, however, this is insufficient. How do we encourage others to have the brave conversations and to be open to listening and subsequently acting to bring about systemic change?
Question becomes, you have a seat at the table. I should let you answer this. This is her book. Here, answer that question. I don't want to be disagreeing.
There's no greater privilege than being in the room with a mentor, even who didn't know they had been mentoring you all their career. My argument is that this debate has caused us to make the table smaller. Find the people who agree with us, and but we need all of the voices, and there is room in this debate. One of the challenges is, I would say our biggest threat right now is that everybody's saying equity. Because everybody saying equity don't mean equity. And I would offer to our colleague at the back, whose faith leans into the 5 books of Moses, and mine does as well, and leans a little bit further into the New Testament as we honor the Pentateuch as well. This debate is about diversity. We were created uniquely, distinctly, and we get threatened by that. So we want to find the folk, and there's not room, and I need a seat at the table. Well, do you? Set another table and show people how to set the table correctly and broadly to honor difference. We believe, Dr. Ross Lee used my favorite word, which is dialogue, because dialogue is not debate. Dialogue is not discussion. Dialogue is not conversation. Dialogue is not negotiation. There is, in the work of Paulo Freire, great old Brazilian theologian and philosopher, he says that we have to be compelled to loosen our grip on certainty. We're all real smart. We got blessed with these brains that are deep and abiding and understanding. But are we really certain? Are we willing to see space for both values at this table so that we can advance change? Clearly, we've not gotten it right. But we can do it without ever saying the word equity or justice or the acronyms.
Don't take it away, and that gets us back to that rule. Listening is important. If all you can do at that table is listen and learn. Yes. Because there's another table, right?
Absolutely. And then I'll just offer that as you shift and grow as a change agent who is leading in, being active. I don't want to just check the box. It's not about the position, it's about the positioning. One of my mentees is in the room, and she quotes that all the time for me. You will be leadering all your life as you're changing and advancing change. When I was the health officer in Ingham County, we had a policy where you, if you had an STD, you could be seen in the clinic on this day. If you had HIV, you could be seen in the clinic on that day. But you couldn't be seen on the same day. Otherwise, the state told me, we won't pay you for both of those visits. Well, I'm just saying that doesn't make sense because many of these patients are dually diagnosed. They have both of these conditions. So you're telling me I got to take someone living in vulnerable circumstances, send them away, and have them come back. I'm not going to do it. Well, you're not going to get paid. Okay, well, I'm not going to get paid because we're going to see these patients on the same day. It's not about me and the model. And that came because my change agents around me were like, this is so frustrating, and I don't know if they're going to make it back. Well, now, guess what? Across the state of Michigan, across this nation, people argue with me that was ever a rule. That's not true. Of course you can see people on the same day. No, I spent months not getting paid in my system because leading in space and choosing to make hard choices shifts systems and shifts policies, but not until you do that work right here where you're sitting.
And getting paid is not the end-all diagnostic excellence, okay? We get stuck with, well, the insurance company won't pay for that. Students, why did you give that patient that medication? Well, the insurance company won't give the patient the medication they need, so I'm going to give them. No. No. You've got to be getting paid is not the everything. That's not what this is all about. It's about the patient, not about you, okay? Every patient, not just patients in general. Okay? Yes, ma'am.
Hello, thank you so much for being here. It's an honor to listen to you talk and to listen to you talk. My question is more about like finding the strength to be able to speak up. I often find that like in my classes, even talking amongst my peers, I feel like I have like a very unique perspective, like as a Black woman in America. And often I hear people say things that I'm like, you don't have the experience, and hence you are able to say what you're saying right now. And I often find that it's often very hard to speak up in those moments, especially when it's like the entire class or even more than that, or even sometimes even amongst like my friends, or even when I do speak up, being labeled as difficult or having an attitude for saying something.
You are really smart. You know that. You couldn't be here if you didn't. Now have some confidence. The issue is not what you say, but how you say it. Sounds really trite. I can't tell you how powerful that is. You can be smarter in your agreement or disagreement with the people around you by how you frame your response. And you can feel proud of the fact that you did respond because it required one. Does that make sense? Use it here. Don't burn yourself out here. Use it here. You got it. Be smarter. Got it? Okay. This a better one? Ah, okay. Oh, this is going to be a hard one.
No. No, it's, this is in the context of a safe space here, and in view of our discussion last night also at dinner. We know that diversity is not only counting numbers. In fact, it should not be counting numbers. So we look at life experience, we talk about allyship. I've been sort of in this space for some time in my specialty. And a lot of time, the question that I get asked, and this is when, again, in the context of safe space, I'm not an underrepresented in medicine person. And does it mean that my opportunity for promotion, for job, whatever, be affected by all this emphasis? How would you, and so I would like to hear
Absolutely.
how you address that. Yeah.
Well, I'm not going to promote you to anything. If you're not Black and female, what are you even applying for? Whoa. How old are you? That's an early lesson. That is my concern and fear, that that's the direction in which we're going, and thinking that that is what promotes diversity, equity, and inclusion. What that situation or environment requires is a leader with vision who then understands the level of commitment that's necessary for healthcare. If you don't have that, then we are playing the I'm this minority game, or how many do you have, or you already have 12%, so we don't have to hire anymore, let's hire. And sadly, that is often a business perspective, and medicine is a business. But again, it's that leadership that needs to be able to get to the high ground on these issues and be able then to see where the problem is and not just deal with the dysfunctional processes that are in the system. But you're absolutely right. You're absolutely. And that, somebody was saying things have gotten worse, right? That is what's worse, is the solutions. That's my granddaughter. It's the solutions that are almost as distasteful as the problem. Absolutely. But again, that's why you're here, right? It just takes voice who say it with the right words, right? And empowered to say that, we got to get to a different place on this, because This may solve that immediate problem, but the real issue is at the high ground. It's not numbers. Oh.
The thing that I would add, though, is about how it is that we go about our task, right? So when Dr. Lim and I were tasked to think about who would be in this space, I'm sorry, my sister told me to stand up. So if you look around this room, there's excellence throughout this room, right? But this room does not look like many of our department meetings, does not look like many of our admissions classes, does not look like the folks who are promoted into leadership. So that's the work. Not about numbers, but when we are talking about what does excellence look like, who are the people in our communities who are excellent? And if you look at that pool and it starts to look diametrically opposite to this room, maybe we should look again. We should look more deeply. We should look more purposefully, right? We should phone a friend. Who do you know?
Networks.
Right? So again, if we go back to how I started our morning and I said, listen, these folks don't need jobs and y'all have jobs. Talk to them, right? And not talk to them when they are seeking, talk to them when they are training, right? Because that is how we develop excellence. That's how we mentor and guide excellence. And then we can advocate for it. That's how we do that work, right? And the reason why we keep coming back to it takes all of us because we're not all in the same spaces all the time. But when we have the decisions to make, are we either holding space or are we creating if it does not exist? So that's what we're pushing for. And that's the conversations I think that we need to start having when we have to make those kinds of decisions, is that the excellence exists. We need to do a better job of looking for it and cultivating it, right? Growing our own.
And not forgetting, the excellence exists. You gotta be good, folks. It doesn't matter whether they're recruiting a different, one kind of person over another. You have to be good. That's your responsibility to you and to, ultimately, the patients you're going to treat in the future or the people you're going to serve.
We have one additional question online. This is from Gregory Goyert. Dr. Rossley, I love and miss working with your daughter, Monica. Please provide guidance for us on how to constructively engage with our friends who proudly proclaim that DEIJ, diversity, equity, inclusion, and justice efforts are just part of a woke agenda.
Know better, though, right? It's about, if you allow the discussion to occur and it's not on the high ground, then your chances of making progress become less. It's not about really, it's about reframing diversity, equity, and inclusion. Whereas diversity is excellence. If you say you need, actually, let me tell you where I got that from. When I was growing up, I didn't have many role models, you know? And Einstein, with all of his flaws, was one of my role models because he was able to think out of the box, right? And one of the observations that he made as he was forming this theory of relativity was the core unknown. We're talking, what, this is early 1900s we're talking, the core unknown. And essentially what he says is, if you want to define the core unknown, you have to look at it from different perspectives, okay? You can't stand in one position with one view and think that you are going to be able to define that core unknown, that it requires different perspectives, okay? And that's how you achieve scientific excellence. Einstein. So you reframe the language. Don't get sucked into where people want you to go. That ultimately reframe it. Then if you don't, if diversity is a woke agenda, how do you achieve excellence? Get back to the scientific base of where we are, okay? In my day-to-day administrative activities, whenever I feel myself reacting to something I heard that's really dumb, okay? When I feel myself reacting, I don't respond. I back up and try and understand why I'm reacting. Once I understand why I'm reacting, then I'm going to use this to get in front of it, okay? Not just react, but figure out a way to get to the high ground and then engage whatever that person or is. Does that make sense? Once you react, you've lost the argument, okay? Once you react, you've lost the argument. So don't allow people to force you to react. So when I hear woke agenda, I laugh. Jeez, shows how dumb you are.
Thank you. Thank you, Dr. Lee. Welcome home.
Oh, thank you.
As you know, there are several hospitals throughout Detroit. I was reading an article a few months ago that talked about 45% of the children in this city experience trauma every day. They go to school with trauma every day. I'm curious as to what you see the role of institutions like Henry Ford or Sinai or these other hospitals around the city to impact that in the environment, in the space that they practice in.
What we don't communicate to the very population that we want to serve is how valuable they are. And we don't have to treat them. They don't need to be patients for us to communicate that value. Folks, get out there and go to a school, go to a church, just sit down and talk, you know? You don't have to deliver health care, but show them how valuable the community is, how valuable the children in the community are. And in fact, get into some of these schools where teachers say the dumbest things to kids that totally derail them. Provide them with inspiration and aspiration just by virtue of the fact that you're there, okay? That they know that there's somebody out there that cares, you know? Even if you can't solve that immediate problem. But without a solution to the immediate problem, there's no hope. So you got to give people hope, especially kids. Yes, sir.
I think, what we'd like to do is that, probably at this time would be a good time to take a 15 minutes biologic break. 10 minutes, I was told. 10 minutes break, and then we'll come back, and then we'll be recharged, and then we will ask you more tough questions.
Okay. Absolutely. And push
right.
back.
And then for those who wants to know, bathrooms are here, and also there is one unisex bathroom down the hall.
We are going to reconvene. So if you can grab your seats, I see Dr. Debolina is actually out in the hallway with the other microphone. So this is going to be fun. All right, one more thing I need to do while people are getting their seats. Dr. Caldwell, This is Jordan Robinson. Jordan Robinson, raise your hand. Okay, so y'all gonna make this connection afterwards. Okay. All right. Anybody else who had a specific clinician y'all wanted to connect with? I can do that for you too. All right, friends. So, Dr. Deb, do we have, we're ready for our next question. So, friends, feel free to get a little more fruit or breakfast or water or juice. We're gonna continue with our Q&A if you don't mind, all right? All right. There you are. Okay, and just for the record, the title of this book is Room at the Table, but I have made room up here on the platform for Dr. Kennedy, so you can ask either of them questions. See how I did that? All right, so our first question is here.
Okay, my question is, I guess it's kind of twofold. So I am wondering how to handle people when they're peopling. And so I
like that action.
I feel like that's really what culture is feeling like these days, right? Just the people are peopling. And so what happens is I am in a role where I am the first in a newly created position, but also person of color. And so I sit at the table that it's apparent that there's other tables that I'm not at. So when I come to the table, I'm asked, what are your degrees in? And those kinds of things versus, or I'm told to stay in my lane, you know, as I'm asking questions to be curious. So how do you handle that weight of the first when the people are peopling?
Again, it goes back to some of the earlier discussions. You have to be smarter than the people that are approaching you that way, okay? And another trick, which I spoke about during the break, is don't own somebody else's problem. Give it back to them. And there are some really nice and courteous ways to do that, you know? Say, when people say something like that, can you help me understand what my lane is? Give it to them. Yeah, it just... Don't own somebody else's problem because, and that happens, by the way, when somebody says something to you and you react. Back away from it. Give it, or this is what I heard, correct me. This is what I heard you say. Is that what you said? Okay, so they have to hear themselves be ridiculous, right? Give it back to them. Don't own somebody else's problem. It's all the, you know, little clues on survival of being the only one there, you know? Never, and again, never be predictable. Never be predictable, okay? Even if you want to be. Okay. Other question?
Dr. Ross-Lee, I'm back here, way in the back. So delighted to have you here with us today, and thank you for doing Martin Luther King Day for us. Several years ago, you were our keynote speaker, and we too, so many of us love Dr. Monica Lee, your daughter, who made so many contributions in terms of the diversity, equity, inclusion, and social justice space. So I just want to start off by acknowledging that.
Skip off the old block.
Oh, there you go. There you go. There, I love it. I love it. And I appreciate so much your words of wisdom because I sometimes hear the professional, then sometimes I sort of hear my mother in some of your comments in terms of watch your words and your words, you know, the connotation that your words carry. And it's not just what you say, but it's how you say it. So thank you so much for your profound comments. My question is more about, I serve as the lead our community health effort, and I usually say CDO, but I'm going to not use the acronym and say Chief Diversity Officer. So I'm already learning, and you never stop being a student. You never stop learning.
And don't you think if you're the chief diversity officer, doesn't that tell me more than saying CEO?
Right. Then CDO, absolutely. You're so right. So many people in this room helped us develop a 5-year strategic plan around diversity, equity, inclusion, and social justice. And we did include how PhD or postdocs can move into sort of that pipeline or pathway in terms of becoming researchers as a major part of their career. How would you, from the standpoint of whether students are in undergrad, graduate school, medical school, that in terms of diversity, equity, inclusion in that justice part, how would you define justice? How can we best address justice in that educational pathway moving forward? Because equity is key. I think many of us understand that. But how can we advance into that addressing justice space?
Like justice is the new kid on the block? The institutions don't even understand it, but the people there feel it. And so it becomes a matter of networking, figuring out how you can bring people into the space. And it's not the diversity, equity, it's the social justice space. Okay, because particularly in healthcare, people have a heart for the issues, okay, but it's a matter of figuring out a way to reach them and bring them in the space, if that makes sense at all, okay?
We have another question online from Valencia Stoudemire. I think it's important to talk about what the table looks like. Oftentimes when we talk about it, it's based on making sure there is a diverse representation to advocate in those spaces. This is undeniably important. But can we talk about the importance of allyship for everyone who has a seat at the table, especially with the recent legal attacks on diversity, equity, and inclusion in education and business? My concern is the watershed impact this litigation could have in healthcare and other areas where we are being intentional in addressing racial disparities. P.S. I miss Monica too.
I do too. I'm impressed with the questions about a seat at the table, by the way. Because that was an issue I hadn't thought about in the depth that people are starting to fill it, particularly as it relates to the revocation or whatever they did with affirmative action. It just makes those people who are at the table, it makes their role more important because it has to be substantive. So if you're at the table, it's got to be substantive. You've got to make a valuable difference. And forcing reactions is not a valuable difference. Being able to engage so you become an asset to the institution that has you at the table, even as you are honest and committed to your issues, okay? Don't be that one issue person, okay? Don't be the only female at the table and think your job is to defend all females. That's not your job. Your job is to be at the table when the strategies are made. So don't allow being placed in a position for, again, you are what you communicate. Be more than what you communicate, okay? And if you do that, then you make a difference and you move away from the stereotype. If that makes sense? Okay, yes. But if you get a seat at the table, take it. I don't care why they gave it. I don't care why they wanted you there. Take it, because you can use that seat for the way you want to.
Just a quick question. Thank you so much, Dr. Rossley. I miss Monica also, as I've explained that to you. But I guess I want to get your thoughts on people don't just use the acronym that we've talked about with justice. They use health, equity, inclusion, and B for belonging. What are your thoughts about that? Health, equity, inclusion, and belonging. To be, you talk about being at the table, we talk about justice, but how do we make sure people feel like they belong, and they should belong at the table? What are your thoughts about using belonging and how do we get the table to understand when you have representation at the table, it shouldn't be the lowly person and I'm representing this. I'm part of it. I should belong to this. This is my heritage too.
I can defend that by saying you got to be at the high ground. And the more differences you have involved at the table, the greater your chances of achieving excellence. I can say that. My gut says belonging is not one of those things that I ever care about, okay? I don't want to belong, I want to have an impact. And now if having a seat at the table is the extent to which you belong, then fine, but you gave me, the belonging is yours. You gave me that seat, and I will use that seat to make a difference. And I won't be predictable as a part of it, okay? I won't, you put the female at the table, so when we need any impressions about women, we look at you. Why are you looking at me? You know, okay. That's your responsibility. Don't let people put you in a hole that fundamentally limits your full impact, okay? Now defend those women, I want you to know that. Okay. We have time out. Dr. Kennedy is about to respond to that question.
Words do matter, but they are also irrelevant at the same time. So right now, again, I think I said one of our biggest threats is that everybody's saying equity. One of our other threats is that we're very smart. If I broke y'all up into groups and said, come up with another word to add to the DEI, y'all would do it. I think alofting. We see something. Touching. Yes, diversity, equity, touch the. So I don't split hairs on the words. Call it what you want to call it. But are we doing something to disrupt the history of this nation that alienated people? Are we doing something to make sure the voices are included of those we're saving? So the question about how do we make sure that we're representing equity in our, you don't. How do we make sure that we're leading in excellence so that change will happen? And that can happen regardless of your skin color. I got a lot of friends that are brown and black, just like me, that are like, here come Renee with her bandwagon. Renee, we're not talking about justice today. Don't bring it up. So it's all of us at the table honoring the heart of who we are and the purpose and assignment that we have. So don't get caught up on the words. Yeah, I know John Powell, former Wayne State leader. We love John Powell. That's his thing, belonging and inclusion. I get it, John, but I'm not going to get tripped up on it if somebody's like, I don't even know what that means. Okay, let's talk about it a different kind of way then.
Yeah, it's not your gender or your skin. It's your perspective. Yeah. Get it to a different place. Yes.
She has a question. I have a question.
Okay.
I have the honor and privilege of serving as...
I have a suggestion. When it's your turn to question, stand up, because we can't figure out where the mic is. Well, okay.
Stand up.
Whoever gets up first to ask the question.
There we go. I have the honor and privilege of serving as MSU's Vice President and Chief Human Resources Officer. I'll say that instead of CHRO.
That lady we get angry with all the time.
Yes.
Right?
Yes. Absolutely. And being the first, being the only. I'm the highest ranking black woman on campus. And the weight that goes with that in terms of sitting in some of those spaces. And there's some spaces I'm not invited to still, and it doesn't matter what my title is. But my question is about peopling, since I work in HR. One of the challenges I have is dealing with the downstream effects of disparities, to paid time off and the benefits offerings we have, and the mental health challenges our employees are facing with depression and anxiety, and it's affecting their performance. And I'm not sure there's much more stress than the time around a performance evaluation and those types of things, hiring. And we face those challenges, and for most of our employees, it's their day-to-day, especially as leaders, supervisors, managers, and having to make decisions that make change and effectuate change. So I'd like to get your advice on how to encourage these leaders, managers, supervisors who are largely dissatisfied, disengaged. In the HR space, we talk more about satisfaction versus engagement. Satisfaction being things like, how much do I make? What are my benefits offerings? Versus engagement in terms of, what can I do for MSU? What can I do to make MSU better? Most employees are asking, what can MSU do for me? Which is an element of satisfaction. And so we're hiring people, evaluating people, dissatisfied largely, disengaged. Many people have given up on, and not just MSU, wherever people work. You know, we show up feeling like, lost that loving feeling. So what advice could you give leaders, managers, supervisors in doing this work? Because this work of diversity, equity, inclusion, justice, it's a heavier weight. We're having to push the envelope without the safety. Many, they don't want to lose their job. It's their livelihood. And so we're only going to go to a certain point. We're only going to say so much if I think I won't have my livelihood. And it sounds real good when we get out there and say something, until I might lose my livelihood. And I'm asked this question often, so I'd just love to get your thoughts on, what could I say?
Employees need to have and be comfortable with expectations. If they reach the point where the only expectation is based upon whatever perks, their salary, then you've already lost that employee as far as the level of commitment that you would like to see. Now, how you establish those expectations starts from day one when they come in. And that day one start has to do with value. Everybody needs to be valued, folks. Okay. And I earned a reputation in New York when I was vice president up there. I fired a whole bunch of people, one at a time, by the way. Never in a group, one at a time. And my reputation was, people would get up and leave my office and thank me, because the fact that you are not working out in a position does not necessarily mean there's anything wrong with you. It's just not a good fit. Let's see if we can work together, if I can help you down the line to find something that fits with the skills that I've observed that you have. And maybe you might want to consider this. And if you need some assistance, I'll be happy to call to help place you in that position, okay? But the issue is, HR is seen as the place that does not value the human being. It's all process and procedure, okay? And that's the only way you change it. You change the expectations from day one. And you make everybody, even if this is not the right job for you, you're still valuable. We all, as human beings, need to be valued. And nowhere is that put to the test more than in a job relationship where somebody's evaluating you, okay? You can be evaluated really low and still walk out feeling like you have some value, okay? I wouldn't have your job, though. Okay.
Apologize, I might sound a little bit nervous, but this is more of I need maybe personal advice in terms of I'm beginning to feel like either I'm pessimistic or realistic in terms of when we talk about diversity. I feel like every time somebody's seen me and I don't fit the stereotypes, I become the exception, not actually prove them wrong. And even if they meet 20 people of me, they'll still think we're the exceptions. And after being in the United States for 20 years, I feel like when I came here, actually, I was more optimistic that I can make a change. And now I'm like, yes, the corporate, I'm a different, my last name probably says I'm diverse, but I feel like they're just, okay, that fits the criteria, but we're blending in. And I don't feel like we're changing that. Does that make sense? When people see me, I'm a physician, but the first thing they talk about, because I'm Lebanese, is a hummus. I suck at cooking. That's the only thing we talk about. I used to feel okay people misspelling my name. Now I hate it. And now I'm becoming like, it's literally Fatima. How can you still mess it up?
Okay, here's the issue. Let's get back to the earlier statement. I'm with you all the way, all the way. That earlier statement, you are what you communicate. The communication is in the recipient, not what you're trying to say, okay? So then the second rule, let them own the problem. Don't you feel bad about this. This is their problem, okay? Now, if you feel committed that you want to help them, that's a different story, but it's their problem. It's not your problem. Don't own it. Don't own it. And you will be surprised if you don't own it, you start to change the environment around you, okay? Treat it for what it is. It's a level of ignorance that is that, and why should you own their ignorance, okay? You can always say, you know, if you ever want to understand, I'm here and available to talk to you, but don't own that problem. That only slows you down from when you're owning all of these biases that exist out there that you have no control over. That only slows you down from making a difference. And the best difference you can make for that particular individual or group of individuals is let them keep it. It's theirs. You don't have to own it. Just be you. Make sense? Yes. This issue of ownership, we don't think about it in those terms. But slowly but surely in all your interactions with people, start thinking about, why am I reacting? It's their issue. It's not mine. Don't let them do that to you. Yes?
Presley, thank you so much for coming. This has been really spectacular for me. I'm John. I have the opportunity to work in the least diverse specialty in all of medicine. I'm an orthopedic surgeon. We can talk, but it's really staggering for it, and it's not uncommon for me to go to a meeting like I did 2 weeks ago and see one woman invited to the podium in the entire week, and 0 colleagues and surgeons of color invited to speak from the podium. And it's not because they aren't sitting next to me in the audience, because I'm sitting next to them in the audience. And when I started being involved in this space 10 years ago, we looked at the numbers and they were embarrassing. And then we looked at the numbers again recently and they're incrementally, but I mean, increment is a very generous term, better than they were 10 years ago. And I guess my questions are two. One, I hear the conversation we've been having about inclusivity and belonging, and one of the challenges I have is that I can shake hands and I can make people feel welcome, but that there's a whole lot of folks that look like me who may not be interested in doing that work. And one of the challenges I have is that outside of my profession, there's a whole bunch of people who are looking around saying, you don't want to be an orthopedic surgeon. They all look like John. and so I can't fight the culture outside my own organizational places I have reach. And I guess, so part of it is a comment, but the real question is you have spoken so elegantly about saying the right thing and being in the right space, and how do you just keep from wanting to burn it all down?
Boy, that's my boy job. I started to make a joke and I decided not to. Yeah. It comes with those of us who are committed, have to make sure that we allow our young people going through the process are able to develop self-confidence, okay? And once you're confident of what your ability is, which means you have to be honest with yourself, by the way. If you're not doing good and that you're not doing good, you either work harder and do well or switch to something else, okay? But that's your obligation, okay? To a large extent, when you pick and choose based upon a crowd that's coming towards you, that is kind of that's not true diversity. That's just an affirmative action process. But what you have the power to do is to build a network with people who are developing young folks. And in interacting with them, because, by the way, a specialty that has very little diversity and very few physicians who wants to go there, right? So you've got to make yourself attractive as opposed to just picking and choosing based on what is in front of you. But part of that is networking. Build a network with the schools, okay? Make an appearance, and so that the students understand that you value them all, irrespective of how they look, or their skin color, or how tall they are, or their gender, whatever it is, okay? And do it not as, here's the king coming in, but I want to see how the difference that medical school is today than it was when I was there. How do you all do this, okay? You value the student, and then you build a network to help you then influence the students to want to move to your, but most of the specialties don't do that, in all honesty. They're very competitive for salary and everything else, by the way. But it's all about networking. Now the organization, let's say the surgical society or whatever, that's a harder one. That's a harder one to get through. But the way to do that is to bring in experts with a different perspective that are not orthopedics or not your specialty. Something that's tangential, important, but not just a representation of what you already have, if that makes sense? Okay. Now, those are just a couple of suggestions off the top of my head, like they'll work, right?
We have one additional question online from Geneva Tatum. Foundational to all of the work, whether it is how we recruit trainees and all others within our workforce, educate, or work to build trust within our communities as healthcare organizations, is the commitment to those values and a vision to manifest them. However, all of this requires a shift in current power structures. How do we encourage leaders to yield power, overcome resistance, and facilitate opportunities for new leaders to bring their perspective to impact change?
Fundamental concept in that question is that leaders have the power to change. You can change without that leadership power. And so it's kind of a self-destructive position or a position of failure. If I don't have power, I can't change anything. Not true. Not true. In fact, most leaders are managers, and they're not power agents. There's a system they have to follow. You, to some extent, in many circumstances, have more flexibility because you're not a leader and you're not tied to particular rules and regulations, okay? So that's a knee-jerk reaction, thinking that leaders have power. Leaders only have power if they have the skill and the ability to make things move, okay? Then that is perceived as power. But that's why everybody calls themselves a leader, because they want to say that they equate it with being powerful, and it's not quite the same. And in all honesty, a leader is not what you need to make change. You can make change from wherever you are. Mm-hmm.
All right, so we're going to take one more question, no pressure. We're going to take one more question, and then we can wrap up.
Okay, my last question is, we spoke a lot today about creating change. Do you have like a generic blueprint for what that looks like? For how do you approach it? How do we get this implemented? Like, who do we, like, just, yeah, a generic version.
I do, and I think I went through the 4 steps. Okay. Number 1, if you're trying to change something, you need to know what that something is, and you need the data and the information to support it. It's not a gut feeling. So you need the studies. Okay, so you got that. Then, once you have that, you would be surprised. You reach out to people and see who aligns with where you are. So now you have a whole bunch of people that can relate to this issue. And once you have that, change starts to happen. Now, if you try to make big change for everybody, not just those people who relate to what you've done, that becomes a harder process because now you've got to engage and incentivize them to change. But if you want to make a change, most of the change that we get involved in is so much common sense, it's just scary that people don't even see it that way. So fundamentally, you start by, if you have a problem, make sure you've clearly defined the problem and that you have the data and the information to back up what the issue is. Once you've got it there, you'd be surprised. Everybody in this room will say, I can relate to that. That is a problem. Once you get people relating, that's when the change starts to happen, okay? And you don't have to be the only one making the change. The change starts to happen.
So can we thank Dr. Barbara Ross Lee?
This has been so much fun. By the way, I do this with the classrooms full of students. They're scared as hell of me.
So one of the things, 2 things actually, it was fortuitous to have the 2 of you here together today. This was such a powerhouse experience, right? So some of us that do this work, remember this moment. So one of the things that I like as a model that Dr. Kennedy encourages us to do. So at the end of each chapter, you notice there are some questions, and then there are some prompts for reflection. So one of the things I'm going to echo from that for today is if you were in here, so I know you're going to go get your book signed, but maybe on one of these other pages, like in the back, take some time to reflect on what are the 2 big lessons or takeaways right, from this experience? And then now what am I supposed to do? What should I be doing next, right? So that's gonna be your homework. Some of y'all knew I was gonna give homework because I always give, every time, every time I talk to Dr. G, I leave with an assignment. So that's your homework. But I really want us to not just be in these spaces, right? I want us to leave with new friends and colleagues, ideas for new projects. And then I want us to be thinking that when we leave this space and we're not maybe physically together, what are the things that I learned today and how can I use them in my work, okay? So, Dr. Ross Lee, there's nothing really enough that we could give you as a gift, but we wanted you to just have some of our swag and this is a simple thank you. So, thank you. And with that, I'm gonna turn it over to my co-chair, Dr. Lim, to wrap us up. Be sure, so Dr. Kennedy, if you want, you can proceed so you can be ready when they swarm you. Oh, just kidding, they want to do a photo first. So we're gonna do a few photos. Our MSU folks, I've been told we need a photo. The greatest sorority in the world, I'm told we're gonna do a photo, and Black women and women of color in medicine, we're gonna do a photo, all right?
All right, just want to also mention that my sincere appreciation and thanks for Dr. Ross Lee to be here. This was truly a very, very informative and very open discussion, which I think is very helpful for all of us. I'm very pleased to see also the diversity of their audience here. This is truly a very, very good turnout, both in person as well as virtually. And I'm certain, we have invited individuals, as Marita had mentioned, who had the position and the quote-unquote power to make change, be it the departmental leader, be it the administrative leaders, and so on and so forth. I know you don't like to use the word leader, but still, that is the position. And hopefully, by coming here and being able to hear what you have to say, would be able to go back and then to continue to carry on this very important work. The inclusion part that we didn't talk a little bit, didn't talk too much about it, that was very, very important, isn't it? Once you get a diverse workforce, you still need to have to make sure that they feel included so that they can, the promotion, as we mentioned before, somebody asked before, would continue to be taken into account when they're doing that. So I think, hopefully this is the beginning of all these steps, the important steps that we all have to take. Again, thank you all very much, and thank you, Dr. Kennedy, for being here and giving us the book, and we'll all have the book signed later on. Thank you all very much for attending and staying to the very end here. This is very nice, but this is because of Dr. Ross Lee. Thank you again very much. Yeah. So, picture, is it correct? Oh, survey first, all right.
You all can scan this QR code. And I hear, because y'all know I'm so generous, I really feel like this is my Oprah day. So the first 5 people who complete the survey, Miss Shepard has, okay, let me get out the way, sorry. Miss Shepard has some gifts. Oh, we will mail you gifts. So the first 5 people, she's gonna get the, okay, so you're the one. You're the one? Oh, so somebody's gonna tell us who the first 5 are, and then we have gifts for you. All right? Once we finish with completing the survey, then we'll have photos, and we release you to the back table to get your book signed. All right? Okay, so all of our Black women in medicine, can you join us very, very quickly? More quickly than that.
Nakia, Eleanor, if you are a Black woman in medicine, please proceed to the front. This is your time. The time is now. Wonderful. And the youth and the young people in training, y'all stand by because y'all gonna hop in a moment. Trainees, would you like a picture with Dr. Ross Lee? If you are a learner, if you are in development and a learner, please proceed to the front to get your picture with Dr. Ross Lee. Okay, if you are a learner or in training, come on, come on, come on. Dr. Gilbert likes to say learners. She doesn't like to say trainees.